Welcome to this episode of Philly Public Health Chats. My name is Rene Nájera. I am the Director of Public Health of the College of Physicians of Philadelphia. In this podcast, we talk and listen to the experiences of some of the frontline workers who lived through some of the most challenging moments in public health history. Today, we are incredibly honored to be joined by two remarkable women. They were both on the front lines of the HIV/AIDS epidemic from the very beginning. Our first guest, Valerie Hughes, began her nursing career in the mid-70s after receiving her RN degree from Queensborough Community College. Over the years, she has worked in critical care settings both in New York and abroad, including a stint at a refugee camp on the Thai-Cambodian border. In the early 1980s, Valerie witnessed firsthand the emergence of what would later be identified as HIV, the causative agent of AIDS. It was an epidemic that shaped her career. She went on to become a family nurse practitioner and dedicated her professional life to HIV care and research, including working at the prestigious Weill Cornell Medical College. Valerie played a crucial role in the HIV clinical trials that helped define the treatments and better understanding of the disease. Our second guest, Ellen Matzer, has been a nurse for over 4 decades, and she has an equally compelling story. She earned her nursing degree in 1978 and spent several years in critical care before moving to AIDS-exclusive units in the mid-1980s. Ellen worked at some of New York City's first designated AIDS centers, including St. Clair's Hospital and Lenox Hill Hospital. Her deep compassion and dedication during those dark days led her to become an HIV educator and program director. Together, Valerie and Ellen wrote Nurses on the Inside, a book capturing their experiences during the epidemic and memorializing the patients and healthcare workers who stood alongside them. Valerie and Ellen's experiences provide a poignant first-hand look into the early days of the HIV crisis, the fear, the hope, and the perseverance that marked that era. As always, the views and opinions expressed in this episode are those of the speakers and do not necessarily reflect the official policy or position of any affiliated organizations, institutions, or employers. This discussion is intended for informational and educational purposes only and should not be considered professional or medical advice. Please consult appropriate experts or resources for advice related to your specific circumstances. With all that legalese out of the way, let's go ahead and start our chat. So thank you, Valerie and Ellen, so much for being on the Philly Public Health podcast today. Let's just get started from the beginning. Let's talk a little bit about your backgrounds. I mentioned some of it in the intro, but Ellen, if you can just tell me a little bit more about your background, how you got into nursing, and how you got to work with people who were infected with HIV, people who developed AIDS, and you work all the way to today.
Well, I started off nursing school in 1976 at Pace University. I was actually working for my dad at the time, who owned the Manhattan News and Penny Saver. And I had gone to Hunter College for a year. I was pre-law, and I was kind of floundering around. I was 16 when I was in college the first time. I asked my dad, I really need to take a year off because I don't know what I want to do. And he says, well, there's a nursing school just right down the block from here, because Pace University was down by Broadway, Nassau Street. It still is. And he said, well, you can work for me and then you can go to school. At first I was, oh God, no, I don't want to take science. I'm not interested, and et cetera, et cetera. So I enrolled in nursing school with the intent of nursing being my fallback position, because I just assumed I would end up in advertising. I would end up running the Penny Saver for my dad. Then, that was my secret, is that I would take over his business. The first time I had a clinical where I actually took care of a patient in 1976, I said, oh, wow, this is for me. When I had a profound experience with it happened to be an orthopedic patient at the time, but I said, oh, wow, this is great. Anyway, P.S., I went on to graduate with my associate's degree and worked for a city hospital for a few months in which the conditions were horrible. And then I made my way to Roosevelt Hospital in 1979, where I met Valerie. And I think far back as 1979, when Val and I talk about it, we realized that we probably saw our first patient with AIDS probably then. It was a patient from France that had a peculiar type of pneumonia, and nobody knew what it was. And it was one of the rare times that the pulmonologist performed a bronchoscopy, because they rarely did that, and it came back pneumocystis pneumonia. And so everybody was talking about how somebody like that could have pneumocystis, and we were coming up with all kinds of odd theories. Well, P.S., he died, and life went on. And then we saw a woman patient at that time who exhibited similar symptoms as acute respiratory failure. And of course, we didn't know AIDS, we didn't know immunodeficiency, we didn't think anything of it, except we thought toxic shock. I remember that because Val and I had a conversation at the bedside and went to check this patient to see if there was a tampon lodged, which there wasn't. And she ultimately died. Turns out she had been an IV drug user as well as a sex worker. Again, no bells went off. Then all of a sudden, we started to see clusters of men coming into Roosevelt Hospital with a similar constellation of symptoms. At that time, we didn't take a sexual history, so it didn't occur to us that they were gay until much later. Except they all came in with this constellation of respiratory symptoms, a prodrome of 2-week symptoms of flu-like symptoms, went to their doctor, told to go rest, have juice, take Tylenol, etc. Except by the time we saw them, they were in such respiratory distress, they needed to be intubated and placed on a ventilator, and soon thereafter died. So then, of course, there were a lot of whispers. Remember back in 1980, 81, there was no cell phones, no internet. So we did not know that this was happening really everywhere, at least in New York. We didn't know. So we went about our business taking care of these patients, wondering, and then conversations started up. At some point, I'll let Valerie add in some missing pieces as well, but for me personally, we both left Roosevelt Hospital within a year of each other, probably 84 and around 1984-ish, where I went to a critical care unit that was closer to my home. I lived in Queens at the time, and it was supposed to be a cardiac care unit, and it was full of people with what we now know as AIDS, but nobody wanted to take care of them. I mean, we are talking serious phobia, double gowns, double gloves, masks, hats, booties. I only stayed there for 6 months after I was reprimanded by my manager for staying in the room too long with a patient because you don't know what you could be bringing out and bringing home to your family. I left there when I saw an ad in the New York Times for the first designated AIDS center at Sinclair's Hospital in Manhattan, which was opening in November of 85. And me and my former husband, who was also a nurse, went there and were hired literally on the spot and started after the weekend. He was a nurse on one floor, I was a nurse on another floor. And we were it. And then they started recruiting nurses that weren't afraid from that very same facility to work on those units. But yeah, what I'm trying to impress upon your audience is that nobody wanted to work there. So back then we hired anybody. I mean, of course, nurses had to have a license, but as far as secretaries, orderlies, they walked in the door and said, these are my people. I need to work with people with AIDS. And I'm talking about gay men and IV injection drug users. And we just hired them and trained them as orderlies and nurses' aides and secretaries.
And probably often they're partners too, right? People who are already caring for them to be deputized into that position.
Yes. In fact, that's a good word. They were deputized right into working in healthcare. Many of them went on to be nurses, as they were nurses' aides and orderlies. Many of them died of AIDS. During the course of those early 80s, we lost several nursing staff to that, as well as to tuberculosis. Val came on board a little while after I started there because I called her and said, well, you need to come here. You need to work here. Although she was hired for critical care to run their critical care unit, many of our patients would not be accepted into critical care because it was thought by the physicians that, what's the point? They're not going to make it anyway. And Val did a lot to change some of that. Again, we left about the same time. That's when designated centers started popping up all over the city. I was recruited to start a new AIDS center program at Lenox Hill Hospital, where I was to be the head nurse of the program. And Val had been doing something else, which she'll tell you about. I then called her up and recruited her. And I said, wow, we need more people here. Would you consider coming to work at Lenox Hill? She ultimately ran the clinic there. And we both stayed there approximately 10 years. Val went to school to get her NP during that time while running the clinic. About 1998 or so, we started to see that people with AIDS, again, were treated more as an outpatient because we had the advent of antiretroviral therapy. And so the designated units started to close. And in fact, at that point, they started to convert our 14-bed designated unit into regular medicine surgery patients. And I was the head nurse of that. as well as another unit across the hall, which was a 32-bed geriatric unit. So at that point, it was time for me to go do something else. And I went back to critical care for the next 17 years in Long Island. I decided to work in Long Island at that time. And probably around 2017, Valerie and I had a reunion of people that I went to grammar school with that I hadn't seen in 50 years. And I just decided, with the advent of Facebook, I was able to get in contact with them. And I had all of these people that I knew when I was 10 years old come over. And we were like, okay, what have you been up to the last 50 years? What have you been up to? And one guy was a dentist and two were attorneys and one was a history professor. And when I said, oh, yeah, I was a nurse and I worked at the beginning of the AIDS epidemic. And one of them said, what? You did what? And I said, yeah, I worked in the AIDS epidemic and now I'm back in critical care. And he said, you should write a book. And I was like, no, I'm not writing a book. I'm not an author. And so the conversation went on and our gathering went on. After that, months later, I started thinking about it. And I sat down at my computer, memories of certain patients, names, dates, birthdays, dates of passing, course of illness, just were flooding back. They were always there. But as I sat down, I started to jot down some things. I started writing a book. It was written in first person. I don't know how many pages I had written, but I just started thinking, wow, I have a lot to say. I have a lot to remember. Never thinking it would be an actual book. But then I said, wait a minute, something's missing. And I got on the phone and I called Val, and we hadn't been in touch for a little while. And I said, hey, Val. And she said, oh, hey. And I said, we're going to write a book. And her response was, what are we writing about? I said, our experience during the AIDS epidemic. And she said something to the effect of like, well, anybody even want to read that? And I said, well, actually, I don't know, but I think we should do it. And thus began our 2-year journey to write the book, have it a private editor, actually several editors, find a publisher, which was very, very difficult. I mean, we ended up going with a small startup publisher who many years later we found were taking advantage of us. And we ultimately just this past year bought the rights of the book. We paid for our own book, to own our own book. So now we are working with a producer and with a documentarian point of view to have the book rewritten in a memoir form as well as a screenplay. We are working on that and hope to have a pitch deck out by this year to have the book come out at the same time as a screenplay. And That's where we are with that right now. In the interim, Val and I did write another book, Beyond the Mask, about the COVID pandemic, using the experiences of other people. And that came out in 2022. The Nurses on the Inside came out in 2019. And ultimately did fairly well in terms of books on HIV and AIDS. And then I'll let you ask Val now.
Valerie, can you tell us about your history and how you got to where you are now?
Well, gosh.
I mean, you can give us the cliff notes,
Oh, I'm giving you the cliff notes, trust me. When I was young, my parents had friends named the Johansons, and Millie Johansson was largely responsible for me getting into nursing school. They were scientists, both of them biologists, and they were instrumental in stoking my interest in science. So I went to school and got hired right away because, it's a funny thing. When you go to school, you really just don't even know what is going on at all. I had no idea what it would be like to try to find a job or anything. I had no idea that there was the most huge nursing shortage in the world right here in New York City. So I got hired before I even graduated from school, and I never looked back. I like to try to put the HIV epidemic and pandemic into a historical perspective for both of us, because we were both very young. We were in our 20s. I was 22 when I started nursing. Ellen was not even 21, right? You were just 21. There was no internet, no social media, no way for us to talk to people outside our own institutions. And so I don't think anybody can understand how isolated we were with regard to what we were seeing. And so that really contributed a huge amount to why it took so long to get things going, to try to find therapeutics, and certainly even longer to find prevention ideas about it. In 1981, which is maybe when we first started seeing one after another, we were probably already at least 2.5 years into the pandemic in New York. It wasn't until 93 that David Ho, who was the scientist at the Rockefeller, was able to identify the true life cycle of the virus. And so we were working blind. We had no idea what we were doing. But, a lot of that is hindsight, and it's interesting to look at in hindsight. But when we were in there facing it, what we were looking at was a disease that had no treatment. It had no cure, and even very little palliation. And so if you were to think about it like a hospice, without a hospice infrastructure, that's what we were faced with a lot of people who were so dreadfully ill. It became what I called, I don't know what anybody else called it, but I said, this is a nursing disease. The nurses who rose to the challenge embraced it, and that's what we did. We focused our life on taking care of people who had this. And of course, so all of that was a big time of evolution for us personally and professionally. So personally, we were finding partners, and Ellen got married and had children. But part of our journey was trying to deal with all of the horrible things that we saw. It was not just the vomiting, diarrhea, skin lesions, horrible fevers, dementia, all of that, which is bad enough. But, that's what nursing is. So we were used to that. But it was society's response to it that was really, really very discouraging. And I was a closeted gay woman, and to hear people talk about homosexuals in a way that was so denigrating was extremely terrifying. It was terrifying for me. I needed to try to do something about that.
And I want to touch on that. You mentioned working blind, and, people of my generation, we were either not born yet or very young when this was going on. And so we don't usually associate the politics of today with the politics of then. But, you said working blind, and I think unsupported, right?
Oh, completely unsupported.
Yeah, because from the historical record and what we know of politics then, you had in the Reagan administration, an administration that was turning a blind eye to the whole situation. They had the National Institutes of Health. They had the Centers for Disease Control. They had people who knew what was going on, but still at the very top, there was no support.
Hey, everybody. So just a quick interruption here in the podcast episode. I wanted to add some context to what we meant by there was no support. So what you're about to hear is a press conference from the White House that happened in October 1982. You will hear a reporter ask the White House press secretary about the Reagan administration's stance on HIV/AIDS. Again, this is 1982, and I just want you to listen to the responses and the discussion that was had at that time, and then I will be right back with more information.
Any reaction to the announcement of the Center for Disease Control in Atlanta that AIDS is now an epidemic, over 600 cases, and over a third of them are dying. It's known as gay plague. No, it is. I mean, it's a pretty serious thing that 1 in every 3 people that get this have died, and I wonder if the president is aware of it.
I don't have it. Are you? Do you?
You don't have it. Well, I'm relieved to hear that, Larry.
Do you?
No, I don't.
You didn't answer my question.
Well, I just wondered,
how do you know?
Does the president, in other words, the White House looks on this as a great joke?
No, I don't know anything about it, Lester.
Does anybody in the White House know about this epidemic, Larry?
I don't think so. I don't think there's been
Nobody knows.
There's been no personal experience here, Lester.
No, I mean, I thought you were...
I checked thoroughly with Dr. Ruge this morning, and he's had no patients suffered from AIDS or whatever it is.
The president doesn't have gay plague. Is that what you're saying, or what?
No, didn't say that.
Didn't say that.
I thought I heard you on the State Department over there. Why don't you stay over there?
Because I love you, Larry.
Oh, I see. Well, let's don't put it in those terms, Lester.
I retract that.
I hope so.
So that was a press conference from October 1982. This is a press conference from June 1983 when there were over 2,000 deaths.
The president has been involved in briefed on the AIDS situation a number of months ago in a cabinet meeting, and ordered that high priority be given to research matters on it. The Center for Disease Control has been involved for some time. The president will continue to be updated. We have recently asked that $12 million be reprogrammed for research on AIDS. That's the extent of the president's involvement, which has been...
Larry, does the president think that it might help if he suggested that the gays cut down on their cruising?
Told you, didn't I? Told you.
I didn't hear your answer, Larry.
I just was acknowledging your interest in this subject.
You don't think that it would help if the gays cut down on their cruising? It would help
We're researching it. If we come up with any research that sheds some light on whether gays should cruise or not cruise, we'll make it available to you.
President Reagan would not mention AIDS as a disease until September 17th, 1985. So this is over 4 or 5 years since the disease has landed in the United States and people are beginning to get sick. By the time that he mentioned it, thousands were sick. And then he ordered federal prisoners to be tested, immigrants to be tested, and other people that were in some way having contact with the federal government to be tested, but did not recommend wider testing than that. From a public health perspective, this is seen as one of the biggest mistakes when it comes to this, because testing would have led people to seek treatment, to avoid infecting others, etc. And so today, in 2024, we recommend people who feel that they are at risk for HIV to get tested, and there are very good medications for it. But back then, the research into the medications was just started, and this is something that I will discuss later in the episode with my guests. So I just wanted to put some context into this idea that they felt alone and they felt ignored, because this is what was happening at the White House at the time during the Reagan administration, a complete lack of acknowledgement that this was a problem. And if you listen to some of the comments that were made, it was, there was laughing, there was joking going around. So now back to the episode. We saw a little bit of that during the COVID-19 pandemic, but now think of this as an administration that was hostile to the people who were sick, right?
Oh, definitely, without a doubt. I mean, just keep in mind who was getting HIV. Men who have sex with men, the most reviled group of people on earth, even more reviled than lesbians. But gay people in general are so reviled. And in those days, it was not 100 times worse. It was 1,000 times worse than it is now, because there's been an awful lot of work in trying to normalize people's perception of gay people. I mean, we've come a long way. Let me put it that way. But the other thing that happened during the Reagan administration that people don't recognize is that he gutted the funding for programs that really helped to keep people in inner cities safe. He gutted care for psychiatric patients. He gutted TB control, management and control. I mean, there were dozens and dozens of nurses who worked in TB control, and nurses' aides all these people would go visit folks in their homes and make sure they were taking their meds and tried to make sure they were housed also. There was a huge effort to try to control TB back from the 40s. But when it came to this time, Reagan said, well, TB, nobody cares about that anymore. It's not an issue. And this came back to bite us in a big way in the multi-drug resistant TB epidemic that happened in the early 90s, which killed many people, including people that we knew, people who were nurses and doctors, administrators, people that we knew got this untreatable form of TB. And although I'm not going to go into it here because it's a kind of long explanation for why it happens, but it's relatively easy to train bacteria to become resistant to antibiotics. And in the way that people were treated then because of the lack of funding, that's exactly what happened. We trained TB to become a lethal disease. So in addition to HIV being ignored because the people who got it were considered not worthy of saving. They were gay. They were sex workers. They were injection drug users. They were not worthy people. So therefore, why should we spend our money on those people? And that's exactly what we came up against all the time. And it was an uphill battle trying to get funding. I don't really understand what changed that allowed us to have a DAX, but finally something did, a designated AIDS center. And that was the only thing that sort of kept a lot of people alive, because it would be years and years before there were effective antiretroviral therapies. In 1987, AZT came out, but DDI didn't come out until 1991. And they didn't even know whether you should give it together or sequentially. They didn't really have any idea, because it would be another 2 years before David Ho could elucidate the actual life cycle of the virus, and so that we would understand that there are areas of exploitation in the life cycle that we could address. Once they figured that out, drug after drug came out. They were not necessarily good, but of course, by that time I was working in research, and so I really saw a lot of evolution in the way drugs were developed and the way the virus was attacked.
Going back 10 years or to the early phase of the antiretroviral therapies, the side effects and everything was bad. And so people, they had to take this to save their lives. But at the same time, when you have a chronic disease that takes a long time to appear, the normal person would say, why should I take this if I'm not feeling sick? This is to prevent you from feeling sick later on, but I'm going to have all these side effects. So what was the battle there with getting people on antiretroviral medication?
Well, the earliest AZT trials, that's the only research that I did. Val did plenty more after that. But in 1987, St. Clair's opened the research trial for AZT, and that was the only thing available, although we had since found out that it wasn't a good drug and we were overdosing people on it. Everybody wanted it. People came to the clinic literally on their knees begging, please let me have AZT. And it was a very strict protocol. We had to draw their blood. We had to walk it to the lab. We had to wait while the laboratory technologists looked under the microscope to count, to see what their white blood cell count with absolute granulocyte count was. And then only if they met criteria were they then actually given the pills. So we were in the waiting room. I remember being in the waiting room, and Val too. We're waiting with a certain patient that we were close to, waiting to see, will we be able to give them the pills? Often the answer was no, because their disease was so far that their white counts were so low that they couldn't get the drug, but yet they begged and pleaded. It brought me to my knees.
People they would do anything to be in some of these trials. I did research for over 20 years, and in the early years, I invariably had a line waiting to get into my office.
And see right there, that demonstrates one of the misconceptions, right? Because now thinking about this, why would a person want something that gives them side effects? But if they've seen their friends, loved ones die from this, and they know that they're infected.
I don't think that you can understand what it's like to watch somebody die from HIV. It's not at all like it looks like on TV. It's massive diarrhea, horrible fevers, sweats, incontinence, horrible skin lesions, bed sores. The smell is appalling, and nobody wants to die like that, and nobody wants to witness death like that. It's just appalling. So infectious diseases are, they're so difficult to deal with because of all of those things. And so it's really very important that as soon as you identify the illness, that you start looking for the cure immediately, because it's such a bad way to die. Same thing happened with COVID. It was a bad way to die. It's just horrible to feel like you're drowning.
And here we are 45 years later from the beginning of the HIV pandemic. And, in a lot of ways, I guess, and again, this is from my own biased perspective of somebody who, has not, thankfully has not had to see this happen, and I'm not a clinician and I'm not in the hospital, but reading about the statistics that this still happens to about 600,000 people a year dying from HIV worldwide, that 1.5 million new infections, right? This is still going on. This is still a pandemic in every sense of the word. And people just kind of have, and I guess in the developed nations and in the West, right, forgotten not so much in places where it is still very much an everyday thing for people.
Yeah, I mean, if you look at multiple countries in Africa, they are dealing not only with HIV, but now a brand new, lovely infectious disease called Mpox. Unless we completely deny our humanity, we have to do something about it. Mm-hmm. Either you think people are worth it, or you don't think people are worth it. Do you think that humans have some value, some innate value, or are some people more valuable than others? Because if you have that latter point of view, you're okay to turn your back and say, okay, I'm not going to devote any time, money, or effort into this. But if you really do believe that, which people claim to do, then they have to be a part of the solution.
And so that brings us to World AIDS Day, right? December 1st. Here in the United States, we have an acknowledgement of, yeah, it's World AIDS Day, but it's not like it was in the 1980s where you had celebrities asking for donations when it was everybody with the red ribbons. I don't see as many red ribbons anymore. That kind of situation, at least here in the US. So that's my question is, what can somebody in the US right now in 2024 do to, number one, bring more attention to the issue, and number two, maybe do something about the issue?
Well, you know, it's funny because I think that I looked up what is the theme for this year. So the theme for 2024 is put people first. Mm-hmm. Mm-hmm. And I think that's interesting. That really resonates with me. And I know it does with Ellen, because when you go to nursing school, the patient comes first. That's almost the very first thing you're taught, is that no matter what else, the patient comes first. All the science, all the art, all of everything serves that end, is that you're there to take care of the patient, advocate for the patient. You're there to be for the patient. You're not there for the science. You're not there for the glory. You're there for the patient. And that's really a tough lesson to learn. But if you have a good teacher, which thank God Ellen is teaching because she teaches that, then we learn it and we start to internalize it. And when you internalize something, then your behavior changes, and your behavior will change towards your patients. And that when you walk in there, even if you don't like them, you think they're ugly, it smells, it's something you don't want to do, but you know why you're there. I mean, you get hired by a hospital, the hospital employs you, but in your heart, you're working for the patient. And that's an important distinction. And it's something that nurses have to relearn all the time, because understaffing annoys you. Social pressure tries to get you to not care about people. Hospital culture also can get you to not care about people. And to be real, hospitals are about the bottom line. And so they're not really about the people either. They're running a business. Right. And so you have to maintain that internalized care of the person. And what the International AIDS Society says about putting people first is that we have to build consensus around the idea of patient-centric care. And so I think that getting that out, that particular concept, I think, is very important, because if everybody who went into the hospital rated it based on the patient centricity of the care that they receive, then they can change things. And I have seen that happen. First of all, the HIV epidemic changed that a lot. It made us have a patient bill of rights. It made us
have HIPAA.
It changed the way we practiced medicine and nursing. And that's really very important. We also have to look at issues like harm reduction and prevention in a way that we never did before. And everybody can participate in that, in harm reduction. So whether it is getting treatment for substance use issues, making sure that you know about how to practice safer sex, and that you're supporting safer sex, you're supporting HIV prevention, syphilis prevention, gonorrhea prevention. Syphilis and gonorrhea have gone off the charts in the last few years because, well, a lot of that's due to PrEP. PrEP is a medication that you can take to prevent HIV. It doesn't do anything about syphilis and gonorrhea. So those two have sort of been left alone to blossom as we've left the latex behind. But the important thing about that is to understand that people have the right to have a sex life. Stop making it so damn cutesy, please. It's part of our health. And so just accept it. don't start saying, oh, you shouldn't have had sex. Well, it happened. The cutesy attitude about sex is responsible for so many ills, unwanted pregnancies, STIs, obviously HIV is included. But anybody can participate in trying to have a real look at how we conduct ourselves on a day-to-day basis. We can recognize that people are sexual. Stop trying to make people ashamed for what they do in the bedroom.
Mm-hmm.
I think that would be one big start, but also just to recognize that people have value.
Mm-hmm. We're, of course, always, or have been for many years, in the middle of an opioid epidemic and crack, and of course, fentanyl now. There's all these social media pages that are dedicated to people now who have overdosed from fentanyl. Just like, there's the AIDS Memorial on Instagram, which memorializes people that died of AIDS, of which I am a strong supporter of and part of. But we also have a big fentanyl epidemic on our hands, and it may not be right in front of us here in New York and New York City and Long Island where I live, but it's certainly a lot in the rural areas where people have easy access to opioids. And if you've watched any of the documentaries about Dope Sick and Painkiller, about the whole opioid crisis and how OxyContin came to be, Big Pharma has perpetuated the drug addict, thus taking away from patient-centered care. I mean, we've put them there, and now we want to blame them. Just as we did in HIV, is that we've blamed people because they were gay. We blame them. Val and I worked for a couple of years with a man named Martin Shu, who is in Kuala Lumpur, where AIDS is still raging and homosexuality is illegal. So people don't get care for AIDS. The only time they get care is when they have full-blown AIDS, and then they get outed at the same time.
They go to jail.
Right. So, we sent some of our books to Kuala Lumpur to be used as educational materials to let them know what happened in New York City in the 1980s was happening there now. He is still doing a lot of research on chemsex and also getting people to accept care and accept being homosexual. There are countries that are just eons behind us. Putting people first has to, it comes into play in just more than the arena of HIV and AIDS. It comes to play in everything that's going on politically right now. Put people first.
So just to put it into perspective politically, some people in government would like to take your choice to have an abortion taken away. Yet at the same time, they make no promises to help you take care of the baby that you didn't have an abortion to get rid of. They say, oh, well, it's a person. It's a person the moment it has a heartbeat. Well, if they really felt that way, then why aren't they treating people who are fully born and maybe 30 years old and who have a disease? Why don't they treat them like a person? I'm just saying that there is a lot of lip service given to the sanctity of life, when in fact there is no true action towards the sanctity of life. I mean, I believe that people are worth taking care of. It doesn't matter what state they're in, whether they have a disease or they were born with a problem, whatever it is, that person is a person and they're worthy of being taken care of. And I think that if everybody could start to look at it that way, that maybe that might make a little bit of a difference in terms of putting people first with HIV.
So thank you so much for sharing your stories. We really appreciated some very interesting insights into the HIV/AIDS pandemic that has been going on for over 45 years and continues to this day with so many people sick. I want to ask you both, where can we find you online? Where can we follow you? And certainly read your books.
You can certainly find us. I run our social media. We are on Instagram and Facebook as Nurses on the Inside. We are on TikTok as Nurses on the Inside. We are on Twitter as Nurses on the Inside. And Our book, Nurses on the Inside 2.0, is in development right now. So the only thing that you can find, Nurses on the Inside, is probably used copies on Amazon. There are some available. Our book, Beyond the Mask, about the COVID pandemic, is available on most sites where you could buy books, Ingram and Amazon and other places. We look forward to having our second version of Nurses on the Inside come out by the end of this year, as well as possibility of a screenplay.
And we'll certainly be looking for that. I'll add all that information in the show notes so you guys can go on there and click on the link. Thank you so much, both of you, not only for being on this podcast episode today, but for the work that you've done. I work with nurses, fantastic people. The rule is never make your nurse mad. Working as a lab tech and the physicians, and my wife as a PA, she knows all about that. But it's the humanity that you bring to a job that, like you said, it's caring for people, it's meeting for people. It's not a job that just anybody could do. And, it's something to be celebrated and appreciated. The things that you saw during the pandemic, not a lot of people could go through that. And so thank you so much for that work. Thank you for putting the word out there about what you saw and what you see today, and the inequities and injustices that need to be addressed in health and in public health. And we look forward to talking to you when the new book comes out. We'll certainly look for you and have a chat then as well. And, thank you so much.
So that was my conversation with Ellen Matzer and Valerie Hughes, two nurses who were on the front lines of the HIV/AIDS epidemic from the very beginning. And here we are 45 years later, they continue their work and continue to inform the public on the risks of HIV and how it really hasn't gone away. It's slowed down, thankfully. We have better medications, we have better tests to detect it, but many countries around the world are still suffering a big burden from HIV/AIDS. On this HIV/AIDS Day, we want to remind everybody that if you feel that you are at risk, that you've been exposed, go get tested. Testing positive is not a death sentence. There are plenty of medications that will help you lead a long and healthy and productive life. And getting tested and knowing your status actually helps prevent this pandemic from spreading further. And hopefully one day we can stop it and bring everybody back to health. So thank you so much for staying with us on this episode of the Philly Public Health Chats. Don't forget to like and subscribe. Don't forget to check out collegeofphysicians.org/events for any of the events at the College of Physicians of Philadelphia, located at 19 South 22nd Street in the heart of Philadelphia. Don't forget to stop by and visit the Mutter Museum. Lots of interesting exhibits there on medicine and medical history. And from all of us to you, thank you for a wonderful second season of the Philly Public Health Chats. We are already starting to work on the third season. Thank you again, and we'll be in touch soon.